Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our host for Redefining Medicine is Dr. Erica Schwartz. For more than 20 years, Dr. Erica has been at the forefront of advanced patient care, taking the best from conventional and integrative medicine and applying them to prevent disease. Dr. Erica is a distinguished A4M faculty member in disciplines ranging from hormone therapy, peptide therapy, and IV nutritional support.
Hi, we're at A4M Spring Congress in Palm Beach, Florida, and it's beautiful. Not just outside, but inside. We have an unbelievable attendance. We have more than 400 new attendees, which tells me that the world is changing and A4M is leading. And I'm so happy to be able to talk to the leaders of the movement. And today I have somebody really, really special. It's Dr. Florence Comite. We've known each other for 20 years. We work down the street from each other. We think alike. We believe that although the labels have changed, it may be functional medicine, it may be complementary medicine, it may be alternative medicine, and maybe, to me, it's prevention. To Florence, it's precision medicine. And things are overlapping. And I think that the conversation with Dr. Comite is going to be really important, not just to me, but to all of you, I hope. Thank you so much for being here, Florence. It's just so many years.
I know.
My God.
We have to stop texting and get together.
Yes.
For real.
For real. We try.
So this is it. We're starting again, a reset.
Yes.
Okay.
It's amazing. Yeah. Amazing. So you just got off the stage.
I did.
Main stage. Beautiful.
Thank you.
What did you talk about?
I talked about the journey I've been on for over 20 years, starting first at Yale when I was in various endocrine departments in pediatrics, adults, GYN, and andrology, actually, which is kind of buried. It doesn't exist, really. It's kind of funny. And why I started thinking the way I thought back then and how I've kind of redefined the way I thought medicine should be practiced. Proactive, prevention, how do you stop disease? How do you reverse aging? And by reversing chronological aging, you're able to stop diseases of aging, or what I think of as disorders of aging. That's what I spoke about.
So you called it precision medicine long before anybody else called it precision medicine. And I must, I've been around for a long time, so I tell the truth. And what you meant by it was the N of one. I remember you talking N of one. It turns out that it is precision medicine, that every patient sitting across from us is a one person, that you have to treat them differently and listen to them. And now we're getting there, but you've been there for a long time. So tell us, yesterday you talked about senescence and about what that represents and how we had a panel discussion. It was amazing, amazing. But now I'm going to let you talk and you tell us about where you are in your practice, what you see as the future right now.
Absolutely. My favorite place is to live in the future because I'm always looking for how we can deliver best on the promise of what really health should be. And so for me, it started actually when I was born, because I was born an identical twin, and I know you have twins, twin granddaughters.
Right.
And I knew from the get-go when genetics started being come to fruition back about 20 years ago, when we knew that we could use the internet to communicate. Whether it's good information or bad information is another question, but there's information out there. It's, I think, more confusing than ever before. And I wondered whether there was a way to proactively turn around what we did so that we took care of each person personally as physicians. We always do, but also using data. Because to me as a physician and to you, I know for sure, it's always personal. But without data, without the ability to open up and peer behind the curtain, there was no way to tell what path to the future a person was on. What is their future health trajectory? How can you proactively take the data that makes up the bits and bytes, as you said on stage earlier today too, and be a detective so that we can apply the best of what we know to each individual human being using a scientific evidence-based model. And that's what I set out to do, created protocols to be able to look at N of 1 in a timely way and to figure out prototypes of people and where they actually fit, so that if somebody presents as a 30-year young person, but their data looks like they're actually 20 years older and there's early death from heart attack or stroke,
Right.
a father passes away in his 60s, a grandmother gets a stroke, then you know that that person is on a rapid track to aging, whereas another person may come in at 70 and be in fantastic shape, be skiing around the world, feeling fantastic, and the data speaks to that. So how do you best serve everybody, each one as an individual?
Right. So you're doing it.
Doing it
Okay.
for a long time, collecting
Yeah.
longitudinal data prospectively.
Excellent. So tell us what you find in terms of, we talk about hormones, we talk about peptides, we'll get to AI in a minute.
Okay.
We talk about senescence. What do you find works the best as far as, like I was saying about the layering approach, whatever we want to call it? How do you start taking care of a patient? And what is your process involved when you're putting together the picture?
Well, it's a great story, and I'll try to keep it brief.
Don't.
AI is the pivotal moment.
Right.
It's a pivotal moment now because I think we can deliver on the promise of what you and I and some of our other colleagues have worked so hard at for so many years. It hasn't been an easy journey, and we both commiserate about that.
Mm-hmm.
But I think the most important place to start in the process is learning who the patient is, getting their health story. I lost the term chief complaint many, many moons ago, because to me it's about much more than what somebody's coming in to say they have a problem, because we want to hear who you live, how you live, who you are, what your family history is, the choices you make, the sleep you get or don't get. Do you exercise? Do you do restorative practices? And all of that adds up to tell us how your genes might or might not express themselves. And now, in today's world, you can actually look even at genomics, and you can tell if a person comes in and they're not sleeping well and they have certain other symptoms that are diagnostic of magnesium deficiency, that we can find out whether do they have a variant that makes it impossible for them to take oral magnesium. So for me, it encompasses all the aspects of how we live life, and looking at metabolism, looking at hormones, looking at whether peptides will make a difference, looking how someone actually lives their life day to day. Do they have a social community? Are they in touch with their relatives? Do they feel loved in a way?
Right.
We get at that by figuring out and asking stories when they first come in. And actually, in my very first conversation with any new referral, I want to know that. It takes about 15 to 20 minutes to collect that health story and get a sense of who that person is and how best to make a difference. So the health story to me is paramount.
I agree 100%. And you know what I think is so funny? I don't know when I said it yesterday, today, who knows? We never know about time anymore. But it's like, I find that at the end of the initial consultation, as they walk out the door, they always tell the most important piece of the story. Do you find the same thing?
Absolutely.
It's unbelievable that that's why it's so important to listen, because at the end, as they're walking out, they'll tell you something that will put the pieces together for you.
I need to tell you that we're thinking about a divorce, or we're moving, and it's only me that's moving, or my son's in trouble. I think psychiatrists have known that for a long time.
But they haven't applied it. So this is the interesting thing, because when I first started doing this, prevention I call it, whatever we call it, precision medicine, functional medicine, when I started doing it, and I had a couch, because I didn't want to sit behind the desk, right? So I had a couch, and I had 2 chairs and the round table between. Everybody who came in, who were friends of mine from the conventional world, said, "Oh, now you're becoming a psychiatrist?" And I said, but we have to know the information.
Absolutely.
And if the patient's more comfortable and they're not across from you, sitting like a mile away, and you're wearing a white coat, maybe they'll feel more likely to share the information.
couldn't agree more. And
I know,
in fact,
it's
I
like
had the
speaking
same
to each other.
principle. We've
one
lived
conversation.
similar lives in parallel.
Yeah.
The same principle. A round table. I never wanted like a square table because I wanted to be next to the patient. And it's really funny that you say that because I come from an immigrant background, so my parents are European, right?
I actually come from Europe, right?
You are.
I am the immigrant. I'm the immigrant.
And I really was brought up more European than American. We used to refer to people as, oh, they're American, right? And I used to say, well, aren't we also American? But my parents are from Europe, and they were smart people. But as you know, there's biases against certain aspects of weakness. So to them, seeing a psychiatrist for any reason is a weakness.
Right.
And I didn't love psychiatry, and I ended up in reproductive endocrinology and endocrinology of all stripes and colors, pediatric, adult, gynecology, andrology, and I was lucky enough to get great training because I thought internal medicine was all psychiatry. And guess what? The mind governs everything. And right now, we tease each other in the center because it is all about how the system works together and the mind is paramount.
Amazing.
So I have come full circle to admit the error of my thinking.
That wasn't an error. It's just that we were trained in boxes and everything was compartmentalized and had nothing to do with each other.
Exactly.
When it's all one. And I always would say, there's only one of you. How can we break you down in so many pieces?
Right, and the silos make it very confusing. I remember the very first woman I saw in women's health at Yale back in 1992. When I started women's health, it was really to look at this cross-section of women who were coming from PMS to perimenopause. They didn't know what to do. Many of them were just starting to have families at 40. Others were sending their kids off to college. So there was this huge spectrum. And I remember this poor woman telling me about her underlying breast issues, 5 doctors and 5 different opinions. And it was impossible for her to get it on the same page.
Sure.
And so thinking back to that time, we've come a long way. It's taking way too long.
And we lived long enough to get to see it, which is wonderful.
In great shape. So I'm delighted
because obviously what we're doing works.
Yes,
that's what I prove.
Yes,
amazing.
I think it's almost intuitive if we let ourselves go back to our basics in what we learned in school and don't get too complicated. We can understand the path everybody's on, and we can help them help themselves in partnership. Because that was another aspect to what I think we changed, as you mentioned, being in a room that made you look like a psychiatrist. It was because you were empathetic. You wanted to you want that patient to feel like they might be your family. Your sister, your mother, your brother, your father, whatever.
Right.
And I remember putting that into action, thinking that's the best way to reach that person as a partner instead of being matriarchal or patriarchal. Here, take this, do this, do that. No, let's hear your feedback. Let's do a wrap up. Let's understand the path you're on.
Yeah, and it works.
It does.
It's unbelievable. And I could go on forever with you, and I wish we'll do it again because I feel like we're mirroring each other.
Yeah.
And there's such a wonderful feeling of community, having the two of us who've been doing this for so many years, watching all these people following in the same path and realizing that it's about healing.
It is. It's about healing. And there's so many aspects. I actually sometimes feel that they must be so overwhelmed because even when we discuss it and the new concepts coming along, we have the contextual ability to fit it into what we're doing and decide how to cherry pick and make it part of our system. Right. But they
can't beat experience. That's the thing. You can't beat experience. I think that this is really where we are here to share it with you.
Yeah, absolutely. And I think to the extent that you can focus as somebody new into the field, pick an area that you want to learn. Study that area. Don't try to encompass everything because every area you study will make a difference.
Right.
So whether it's lifestyle and how to help someone sleep better and maybe pick the right wearable and study what happens there, or do hormone testing and recognize what's the best way to do it, how can I best implement it, how do I work with the person, look at metabolism, maybe encourage someone to wear a continuous glucose monitor. There's so many ways to now break into the system, whereas we didn't have any of those tools.
No.
We had to do it on our sheer expertise and our passion.
And faith. A faith that we were doing the right thing. And you know
Trust in
what?
ourselves.
A4M is really, I'm telling you the truth, and you know I'm telling the truth, is the only place that offers all the support for you to be able to, 30 years later, say, I've done it this way, the way we've done it really, and you don't have to follow a protocol. You don't have to follow. You just have to understand what healing really means and become a real doctor. And I have to tell you, this is the place to go. So don't forget us. Thank you.
Thank you so
Florence,
much.
it's such a pleasure.
Yeah, same here.